From 12 News, this is Newsmakers.
Welcome to Newsmakers. I'm Tim White alongside 12 News Politics editor Ted Nesi. Our guest this week is Christina Paxson, president of Brown University. President Paxson, it's good to see you in person again. I apologize for the studio setup, but it's a product of our environment right now.
Well, thanks for having me on the show. I'm really happy to be here.
I want to start with COVID. At Brown University, in-person classes begin January 26th. Other schools in the region have opted to start remotely, but you made the decision to require everyone on campus to get tested twice a week instead. What is the threshold for you on the distance learning call, or is there almost no scenario in which you would do that?
That's a really good question. I mean, we have changed our testing strategy considerably. We're using rapid antigen tests twice a week for students, testing before they come back. And I think one of the most important things is there is absolutely no evidence of transmission in classrooms. So students are going to go to class, faculty will be there, they're all vaccinated, they're all boosted, and they're all wearing masks. And we think it's safe. When I think about the thing that could make us transition back to something that's more remote, it would be if I felt like the safety of our community was threatened. So it's really all about safety.
Are you hearing at all from students, faculty, or parents who aren't happy with that decision?
You know, it's interesting. There are always some people who are unhappy, but after we sent out the notice earlier this week, really saying, what are we going to do? Here's what's going to happen. Here are the protocols. I received a number of emails from students, from parents, and from faculty who said, this is great. This is the right thing to do.
Are you less concerned about COVID spread this semester than maybe you were last semester because the Omicron variant is what's so prevalent in Rhode Island, and we know that maybe spread's the wrong word, but the severity of it does seem to be lower?
So, you know, I'm always concerned. I've been concerned for the last 2 years, and that's not going to abate until this whole thing is over. But the difference now, a couple things are really important. We have a virtually fully vaccinated, with some exceptions, and boosted community. And what we're hearing from our public health experts is that with Omicron, people who are fully boosted and vaccinated are at far less risk of severe disease. So that gives me a lot of assurance. And
what lessons, if any, do you think the broader society can take from how colleges and universities and their kind of nucleus have managed COVID and tried to balance out risk of spreading the disease versus letting life go on?
I think what we have tried to do, and different colleges and universities are doing it differently. That's fine. It all depends on your situation, when you start, things like that. But all of us are following the data and the science. And we're so lucky to have Dr. Ashish Jha, who's the head of our School of Public Health, who I think is doing a fantastic job getting the data and science out to the rest of the world, and also, clearly advising the Brown administration on a daily basis.
Brown is supplying KN95 masks and tests, which have been in high demand and hard to come by for a lot of people and in a lot of agencies, a lot of governments. Are you finding it hard to get your hands on them?
Well, we certainly have enough supply to get us through the early part of the semester. And my sincere hope, and I think the data are starting to point in this direction, is that this surge will be on the downturn, and when it goes down, it will go down fast. So there's that. And I think there'll also be an expansion of supply nationally, as there should be, given the government's push on this.
I have one last question for you on this topic. Brown economist Emily Oster wrote in The Atlantic about remote learning, quote, "This decision is a mistake. It reflects an outmoded level of caution, and it represents a failure of universities to protect their student interests." Do you agree with her?
Well, she put that in a very strong way. And as I've said, I would never say that the decisions of another school are a mistake. They're balancing lots of competing priorities. What I can say is that this is the right decision for Brown.
All right, I want to turn to a big topic, which is the Lifespan Care New England Hospital merger, which Brown, of course, is a party to. And that's actually where I want to start. I'm sure for some people, it's still a little fuzzy, Brown's role in this. You know, you're not going to be one of the owners of the new hospital group. No. It's Lifespan and Care New England are actually merging, but you are going to be affiliated and you are putting money up. How would you describe Brown's role in this new entity if it is created?
It's a very good question. I'm glad you asked that. So as you said, we are not a legal party to the merger. When this is over, we will not own the health system, just like we don't own it now, neither of them. Currently, we have affiliation agreements separately with Lifespan and Care New England. Having this bifurcated system has made it very hard to do the kind of joint strategic planning and joint investment in healthcare research that we'd like to do. So what we're imagining coming out of this is a stronger affiliation agreement, more investment, which we're eager to make, and more coordination and planning that is going to benefit all of Rhode Island.
Care New England CEO said recently he expects a decision from the FTC by the end of February on whether the merger will be allowed to proceed. What happens if they say no?
I don't know yet. That's really up to the health system CEOs to figure out what the next step is. You know, Brown will continue to do everything we can to, you know, coordinate research, to build that NCI designated cancer center. It'll be much harder if the merger doesn't go through, but we're going to do our best to continue. There's some other options. People have talked about COPA legislation. People have talked about the Rhode Island Attorney General stepping in and doing something. I just don't, I'm not in those conversations.
Can Brown achieve its goals for the medical school if the merger doesn't go through?
Not as well. Not as well. We will be in a much better situation to achieve our goals for the medical school, the School of Public Health, and for Rhode Island with the merged system.
You commissioned a report out this week that made the case for the economic benefits of the hospital merger, and it did get pushback from multiple prominent experts, some of your own School of Public Health, who basically said it's not really an independent report when Brown commissioned it to, you know, support something that Brown wants to happen. What do you say to that critique that this was kind of, you know, bought and paid for even if it was described as independent?
Well, let me back up a little bit. We have known for years that there's a lot of potential for building in biomedical commercial activity in the state of Rhode Island and research and things like that. Go back to the Brookings report that the state commissioned in 2016. Makes that case really clearly. What I wanted to do, so I think there are benefits. I've been very open about that. What I wanted to do with the Umbach report was a few things. One was to start to put some numbers around what we might expect coming out of the merger. And, you know, if you'd asked me a month ago, how many jobs do you think could be created? How many billions of dollars do you think could be generated as a result of the merger? I wouldn't have an answer to that. Now with the Umbach report, I have estimates of what that might look like. Might it be, instead of, you know, $5 billion of gain, might it be 4, might it be 6, 10,000 jobs, 12, 8, you know, sure. There's going to be some imprecision around the estimates. But it does give us a very good starting point for discussing what the economic benefits of the merger might be over and above the health benefits.
As Ted pointed out, the FTC could have a decision at the end of February. There's a lot of moving parts with this decision. You have the Attorney General's office, the Rhode Island Department of Health, and of course you just have two mega healthcare companies, Lifespan and Care New England, just coordinating all that. Stepping back at 30,000 feet right now, President Paxson, how confident are you right now that this is going to come together?
I can't lay odds on it. I think the arguments for it coming together are so compelling. And maybe it's the optimist in me. At the end, I think that the right things will prevail. You know, one thing that I just want to, if you don't mind, you referred to both of these systems as mega health systems.
Okay.
In the scheme of things in the world, neither Lifespan nor Care New England are big. They're actually quite small.
Relative to Rhode Island, I
Relative
suppose.
to Rhode Island, but I think when we talk about one of the main benefits of the merger, it's getting the scale that we need to do the prevention efforts, the coordinated treatment, coordinated clinical care, and the great research that you get from a larger at-scale health system, which we don't have.
Do you
right
really
now.
think the average Rhode Islander will get better care because they are under one roof than they're getting right now?
I absolutely do believe that. And right now, because we have separate health systems that are largely complementary, so many Rhode Islanders are shuffling back and forth between Care New England and Lifespan. I know I've done that personally. I go to one doctor, they don't have my records because my records are with my my Care New England physician. And the lack of coordination means that patients are not getting the kind of treatment that they should have. There are areas of medicine, I'm no doctor, but I've spent enough time with our health system people and my medical people to think about it. You have somebody with a complex chronic condition. They have diabetes. They need care that comes from lots of different pieces of the healthcare system. Right now, they're not getting that in a seamless way. There was a report that came out just this week, a merger in New York. It was NYU Langone and another hospital whose name is escaping me right now. But what they've documented is very dramatic improvements in quality coming out of that merger. That's in the Journal of the American Medical Association. So I am very convinced of this.
I want to ask about you. March marks your 10-year anniversary as president of the university. Congratulations.
Thank you.
COVID aside, what do you wish you knew? What do you wish you knew now, or then that you know now?
Oh dear. I've learned a lot in the last 10 years. This is the best job I've ever had, and it's certainly going to be the capstone of my career. What do I wish I knew now? What do I wish that I'd known when I started?
Yeah.
I don't know. I mean, there's just so many different things. I wish I'd known how to manage through a pandemic. I wish I'd known how to navigate some, difficult, complex issues within the city and the state. So I don't think there have been any big misfires, but I know that I've learned a lot, and if I had to redo, maybe some things would be a little bit better.
There isn't a lot of turnover at your position. I think I noted this the last time you were on this program, but you are only the 19th president in the school's 257-year history. Begs the question, how long do you see yourself at the helm?
You're asking me a question that is really up to the Brown governing body, the Brown University Corporation. They hire and fire the CEO.
But you could leave if you wanted.
I could leave if I wanted, and I don't leave. I don't want to leave it in the immediate near-term future. There are too many important things that we're doing right now, and I think coming out of COVID, building engineering, public health, medicine, plans for a lot of development in the Jewelry District, which will be facilitated by the merger. These are things that I'm really excited about. Now, I am not going to see all those things to their end, but I will at least be able to get them really moving in the right direction, and that's what I hope to do.
All right, we're going to take a break on Newsmakers. Our guest this week is Brown University President Christina Paxson. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White alongside 12 News politics editor Ted Nesi. Our guest this week is Brown University President Christina Paxson. President Paxson, it's been a violent year in Providence. Shootings are up, as are homicides. Providence College has been in the news because there have been some incidents in the area. Has all of this impacted Brown University?
Well, I mean, clearly it's something that we're very concerned about. We haven't seen an uptick in violent crime on College Hill, but it's a big problem for Providence. Megan Rainey, one of our physicians, is very involved with the Nonviolence Institute. That's something we've been supporting. So we're trying to do what we can, excuse me, to help address the issues that the city is facing.
In a related story, Mayor Jorge Elorza has enacted a vaccine mandate or terminate policy. At last check, 80 police officers have not received at least one dose and could lose their jobs. That's not an insignificant chunk of the police force. Now, the deadline is today. We are taping this program on a Friday morning, I should note. Are you concerned this could impact public safety on the east side if Mayor Elorza goes through with this?
Well, one thing I would say is if any police officers are watching this show, get vaccinated. Please do it. It's so important. The Brown Department of Public Safety is entirely vaccinated, and we have a booster requirement. So I think we'll have our own team in place, which is really looking out for the campus and parts of the campus in the Jewelry District as well. So I'm not too concerned for Brown's sake. I would be concerned for the broader community's sake.
I want to ask you about the endowment, which just finished its last fiscal year at almost $7 billion, huge amount of money. I remember when it was 3-something. You can't touch most of that money immediately since it's meant to be saved and to grow for the long term, but even the small share of its annual income that you're allowed to spend is going to rise significantly. What are the top priorities for Brown in spending that increase in the endowment that's coming?
That's a great question, and I'm glad you noted that we don't have complete discretion as to how that money is spent. An endowment is actually made up of thousands of individual accounts that are designated for specific purposes. And so if they grow, if they start to spin off more money, the money has to go to those purposes. Now, fortunately, the largest chunk of the endowment is designated for financial aid and scholarships. And so in October, we announced a number of initiatives, such as no longer counting home equity as an asset when students apply for financial aid, our strategy over a series of years to become need blind in admissions for international students. And we also announced a new college access pipeline program that I hope will bring more students from Providence into Brown, as well as into other institutions of higher education. So that's one of the top priorities.
And on that latter program, I was curious, have you made any progress getting going on that? How soon could students in Providence actually benefit from that proposed program?
So we are making progress on that. So for people who haven't heard about this, the goal is to identify cohorts of students, starting with Providence Public Schools, and really help them prepare for four-year colleges. You know, we know the state has a very ambitious goal that 75% of Rhode Islanders, maybe it's 70%, should have a degree or certificate by 2025. Very ambitious. We want to help make that goal a reality. A lot of students are going to community college, that's great, but there are other students who should be going to great four-year schools. Where we are now is we have a consultant, very experienced, who is interviewing stakeholders, getting a lot of feedback from the community, because this has to be done in partnership with others. And my hope is we will have an outline of a plan by May, and that we may be able to start enrolling students next year.
How about the physical footprint of Brown? You mentioned the Jewelry District earlier. People wonder, you know, how much room is there really for you to keep building on College Hill? And there's always hubbub about historic buildings and sort of dislocation. And then there's all that you're doing in the Jewelry District with the medical school.
Yeah.
You know, where do you see significant physical growth for Brown in the coming decade?
So I think a lot of attention has been focused on dormitory construction, which we thought was important because people don't like the students living out in the neighborhoods, and we wanted to pull them back to College Hill. We're done with that. I have no plans to build more dormitories on College Hill right now. The focus will be on building laboratory buildings, mainly in the Jewelry District. There are a few parcels of land on College Hill that we control that actually have no historic buildings on them and are very much embedded in campus, where we could do some things for the physical or life sciences on campus. But that will be the focus in the coming years.
Brown is building a dorm though on Thayer Street right now. I think
Yes.
that's where the old
Brook Street.
Brook Street, excuse me,
Street,
where
right.
where the District 9 substation was for the Providence Police
That's
Department?
right,
Okay.
that's right.
And I believe Brown provided a temporary location for the police to relocate free of charge. Do you know if there's going to be a permanent location for that substation yet?
I don't know.
Okay. I got to ask for the people who are fans of Bagel Gourmet, which is on the bottom of that. What's the bottom level of that dorm going to be? Are you raising the whole thing, or are you going to, is Bagel Gourmet sticking around?
Well, so Bagel Gourmet is now located to another home. I don't know whether they'd be interested in being in that space, but working with community members, they identified really a desire to have some sort of publicly accessible restaurant, something, you know, pick up food kind of space, sit in the park and eat it. we haven't decided exactly who that tenant would be, but that's something that's definitely in the plan.
You brought up Need Blind, and I'd be remiss if I didn't ask you about this. Brown University was one of 16 defendants in a class action lawsuit that it allegedly conspired with other schools to determine financial aid awards for students. And look, I won't litigate the lawsuit. Your spokesperson already said the suit has no merit, and the school's ready to mount a strong effort against it. But in the complaint, it states Brown has, quote, a generally wealthy and privileged undergraduate student body where the median family income of undergraduates is $204,000. Are they wrong?
Those data, I think, actually come from the analysis of one of our economics faculty members. So if that's what they're quoting, I have no reason to doubt that it's wrong. You know, in the country, nationally, we have great disparities in educational access. That's something we're really concerned about and that we're trying to change. And that's why, we're expanding our financial aid awards. We're doing more to recruit first-generation low-income students. So this is not a case of going out and finding wealthy kids to come to Brown. We want the most talented students regardless of family income, and we really want to be proactive at finding students whose families earn less than $60,000 a year, less than $125,000 a year. Those students don't pay tuition when they come to Brown. And if we can find talent in those income ranges, we want those students to come to the university.
There's a perennial debate about whether Providence is contributing enough money to Providence's city coffers.
Brown is.
Excuse me, Brown is, yeah. And a lot of people around here noticed last fall when Yale announced a deal to give New Haven a total of $135 million over the next 6 years, far more than Yale had been giving previously. Are you considering any kind of big increase like that in your financial commitment to Providence?
Well, that's so a couple things. We have actually 2 different MOUs with the City of Providence that will be expiring in the next couple years. And we will start discussions with the city to figure out what makes sense. I expect that our contributions to the city will continue and most likely expand. We want to be good neighbors. And in addition, we're growing things like the Fund for the Children of Providence and our investment in K through 12. So we will be supporting the city because we want to, and it's the right thing to do. But what form that takes is still TBD.
So is the Yale commitment to New Haven, a different magnitude of what you could imagine Brown doing in Providence?
I don't know. I mean, Yale is a much wealthier institution than Brown is, even though Brown is wealthy, and New Haven is a bigger city than Providence is. So I don't know that would serve as the right model. But we'll be looking at different options and discussing it with the city when the time comes.
Real quick, the Performing Arts Center, is it still on track to open in 22 this year?
It will open in the spring of 23.
Of 23.
So we had some, not dramatic, but some slowdowns in construction because of COVID. It is hard to maintain social distancing on a construction site, and there have been supply chain issues, but they haven't put us that far back. So it's moving forward, and I'm excited about it.
Returning to COVID, before the pandemic, there was a lot of talk about the benefit of remote learning and how it could, be the future of education, higher education. A lot of universities offer online degrees. The world was forced to try it, right? And I wonder what the verdict is now in your view.
So that's a really interesting question. And I think we have learned a lot, and we've learned that there are areas where remote learning works really well. So we actually have some faculty members who say, look, I've converted my course to online. It's better that way. I want to keep it that way. And we've said, great, that's fine. And for graduate degrees, some graduate degrees, I think remote really works pretty well. But what we've learned from our undergraduates is the college experience is more than just hearing lectures and sitting through classes. It's about being together, social development, interactions, talking to faculty. They don't like being home going to college. And so it kind of, for me, underscored that what we have always sought to provide, which is a really high quality, high touch residential experience, that this is going to be our core for a long time going into the future.
Your admit rate is very, very low, as it is for most selective colleges, especially Ivies. Could you see any? There's demand. You're an economist. Supply and demand. There's great demand to go to Brown. Considering a significant expansion in the size of the undergraduate classes, so that you could have more people go to Brown.
Well, probably not, because as you alluded to earlier, the College Hill footprint is a little bit constrained, and a significant expansion on College Hill would be a problem. One thing we have learned from this pandemic, though, is that students can do study away, study abroad, beam back to classes, beam back to campus and take some courses remotely. That sort of model can work really well. So it's not the full college experience remote, but a little piece of it. And so we're thinking about doing some very innovative things that would maybe let us grow the undergraduate student body 6%, 7%, without growing the number of students who are actually on campus at any one time.
20 seconds or less, what was your reaction to Dr. Nicole Alexander-Scott leaving, being director of the Department of Health?
Well, I have so much respect for her. She is a Brown alum, I will say, but even independent of that, I'm sad to see her go. She's been fantastic.
All right, we got to go. Thank you for joining us this week on Newsmakers. For Ted Nesi, I'm Tim White. We'll see you next week on Newsmakers.